Hi, we're Group 15, and we are going to be presenting on bevacizumab as a therapeutic treatment for cervical cancer. And this is the order we will be presenting in.
In this slide, we're going to be discussing the anatomy and histology of the cervix. The cervix has two main components. The ectocervix is located distally of the endocervical canal and is predominantly made up of stratified squamous epithelium cells. The endocervix is lined with columnar epithelium cells, which is also commonly referred to as glandular epithelium, and is located medially in the cervix. The most common type of cervical cancer is squamous cell carcinoma of the ectocervix. Squamous cell carcinoma accounts for as high as 90% of cervical cancers. This is mainly attributed by the presence of HPV oncogene expression. Another subtype of cervical cancer is adenocarcinoma, which is cancer of the endocervix. Adenocarcinoma accounts for approximately 10% of cervical cancers. In this study, we will be focusing on squamous cell carcinoma of the ectocervix. Avastin works best when targeting malignant tumors that are rapidly increasing in size and nutrient demand.
P53 is a tumor suppressor protein which resides in the nucleus. P53 plays a crucial role in honoring the integrity of the genome by conducting actions such as cell cycle arrest and DNA repair. A mutation of P53 leads to the increased likelihood of developing cervical cancer. This mutation occurs by the E6 protein binding to the P53 protein and guiding it towards uncontrolled cell proliferation. If we look at the image, epithelial cells in the cervix undergo abnormalities upon HPV infection. In the instances which leads to cervical cancer, cervical intraepithelial neoplasia occurs. Viral proteins E6 and E7 are released and inhibit apoptosis. This leads to an inappropriate immune response, uncontrolled cell proliferation, and genome instability.
Avastin's impact on angiogenesis. Avastin targets the vascular endothelial growth factor A, or VEGF-A, that regulates vascular growth and permeability, as well as endothelial growth. Avastin binds to VEGF, preventing its interaction with receptors on endothelial cells' surface. The hallmark that Avastin acts on is an angiogenesis inhibitor. Without Avastin, abnormal amounts of VEGF-A would be able to continuously stimulate VEGFR2 receptors, causing dimerization, then transphosphorylation. This activates the tyrosine kinase cascade that ultimately leads to angiogenesis. VEGF-A can bind to VEGF receptor 1 or 2, but more commonly binds to VEGFR2 as shown in the image. In normal cells, VEGF is an anti-apoptotic factor which prevents premature or excessive cellular death of vascular cells. In cancerous cells, the VEGF factor is overexpressed, which is a critical component of tumorigenesis. It is possible to acquire cervical cancer through your family due to a speculated condition as to where some women are less likely to fight off an HPV infection. Many of the blood vessels that survive Avastin treatment will have reduced permeability, resulting in less fenestrations. Reducing vessel permeability has also been found to improve combined chemotherapy treatments. As you can see in the diagram, when there is no Avastin present, there is an abnormally high amount of VEGF binding to receptors and stimulating blood vessel growth. With Avastin binding to VEGF, there is no interaction with the VEGF receptors, preventing blood vessel growth and a lack of nutrients to the tumor.
Characteristics of Avastin patients. Avastin works by preventing the growth of blood vessels. It is recommended that treatment is discontinued if progression persists. Avastin is prescribed to patients with more advanced stages of cervical cancer. This can mean that the cancer has metastasized, is reoccurring, or is persistent despite treatment. Avastin is usually accompanied by paclitaxel or carboplatin, or paclitaxel and topotecan. These chemotherapy and Avastin combinations have shown to extend relative survival by an average of 4 months. Treatment protocol and patient experience. Before treatment starts, a blood test will determine blood cell count. Avastin is given with a combination of chemotherapy drugs intravenously every 2 to 3 weeks. The most common side effects of Avastin include high blood pressure, nosebleeds, headaches, and skin rash. More serious side effects include abdominal pain and wounds not healing. Patients should check with their BP regularly. Avastin is strictly prohibited for pregnant and breastfeeding women as it can cause fetal harm. The first dose is given in increments, a 90-minute increment, to ensure that there is no allergic reaction before treatment proceeds. Next treatment is around an hour, and the remaining doses are 30 minutes. Mechanisms of resistance. Mechanisms of tumor resistance to Avastin still remain relatively unknown. Resistance can be primary, taking place before the drug has been introduced, or evasive, meaning that the resistance was acquired. Acquired resistance occurs when tumor cells acquire an adaptation that allows them to circumvent the angiogenic blockade. It is thought that cancer cell microenvironments provide alternative pathways for angiogenesis. The top portion of this diagram to the right demonstrates acquired resistance. Initially, treatment is effective in achieving a response, but mutations lead to alternative pathways for angiogenesis. The bottom portion demonstrates primary resistance. A response is never achieved in primary resistance.
Cervical cancer has an estimated annual incidence of 529,000, with a quarter of these new cases resulting in mortality. In 2020, the global mortality had increased to 340,000. Most cases of mortality occur in low to middle income households, mainly due to limited or no access to preventable programs such as screening programs. Cervical cancer has a wide age of women it can affect. It affects women ranging from 20 to 60 years old. HPV infection is the biggest risk factor for the development of cervical cancer. In a large-scale screening study throughout China, HPV infection in regions where regular screening occurred was 9.6%, which was much lower compared to regions where regular screening does not occur. The infection rates increased with age. HPV DNA was detected in 95.4% of patients, and among that 95%, 80.6% were single infections. Thus, a single HPV infection is a huge risk factor for developing cervical carcinoma. Vaccines are a preventable measure utilized to prevent HPV infection. However, there's a large inequity in the distribution of vaccines. For example, in the United States, about 75% of girls have received one dose of the vaccine, but less than 5% of girls have been vaccinated against HPV infection in low and middle income countries. In a gynecologic oncology group phase 2 trial, 46 cervical cancer patients were treated with Avastin, 21 of which had an objective response. In another GOG phase 3 trial, chemotherapy combined with Avastin proved to extend overall survival of recurrent and metastatic cervical cancer patients. Avastin has shown no evidence of benefit for locally advanced cervical cancer.
Avastin is proven to be well tolerated, but side effects are distinct compared to traditional cytotoxic chemotherapies. This is likely due to novel pathways being targeted. In an AVAGO phase 3 trial, there was a hazard ratio of 0.64 and a confidence interval of 0.55 to 0.74. After 6 months, survival rate is 92.53%. It is reported that physical, cognitive, and emotional function all increased after treatment. Sexual enjoyment and functioning did happen to decline post-treatment. Unfortunately, patient prognosis is poor and no benefits are seen once progression has occurred.
Avastin is an angiogenesis inhibitor which blocks the function of VEGF-A. All tumors need a blood supply of fresh nutrients to be able to grow. Blood vessel generation is a primary way of achieving this, and VEGF-A facilitates this action. Inhibition of VEGF-A prevents the generation of new blood vessels to the tumor and ultimately prevents a crucial hallmark of cancer for that tumor. The rationale leading to Avastin development is despite mass screening and vaccination programs, cervical cancer is still a world leader in cancer deaths among women. Over time, with these patients getting constant poor prognosis and an overall survival of just around 12 months, the need for a more adequate treatment option appeared. Advancement in the understanding of tumor growth and tumor function led to anti-angiogenic agents such as Avastin as a promising route for tumor shrinkage in cervical cancer patients. Multiple trials of the Avastin treatment combined with chemotherapy has shown that overall survival and quality of life increases with this treatment.
And here is our bibliography. Thanks for listening.